Good evening, everyone. All those who have joined us live today and who will be watching this live later at your convenience. I welcome you all for this live that we have with Patricia Hatherly. Patricia, welcome and thank you so much for coming live with us.
That's my pleasure. Thanks for inviting me.
Yeah, it's our pleasure to have you, and you are an internationally accredited lactational consultant, and we have you for our module Milk Matters. So I think it's going to be a lot of fun, a lot of learning. Thank you so much for agreeing. Yeah,
I like to share information about breast milk. I'll do it anytime, any day. It's my pleasure, my passion.
Yeah, we can see how passionate you are because Patricia, as we all know, that you have written books on lac remedies, and you've written so many blogs and so many articles, presented papers just on this topic of milk. And milk does matter to you. We can get to know about that.
Yeah.
It's great.
I mean, I am a classical homeopath and I treat all sorts of things like we all do, but it's because of the expertise that I have in lactation that I really focus on sharing what I know to help my colleagues understand a little bit more about lactation and its importance and how to manage clinical issues, because I mean, the breast is a very complex endocrine gland and you need to be able to manage it, because sometimes it's a sign that there's some deeper pathology going on, and it's not just a simple matter of making milk or fixing a nipple. It's much more than that.
Absolutely. So Patricia, tell us, how did you get so interested into the human milk and lactation and the issues? Tell us about your journey.
Well, it started when I was a child. I mean, I was always interested in breastfeeding. I used to breastfeed my dolls, and when I say my prayers at night, I used to ask God, give me a baby that I could take to school. I mean, I was really bad. And I can remember when my mother had my fifth sister. I'm the eldest of 6 girls, and I was 7. And I used to get up at dawn and give her the bottle. And then when she had the next baby, I was 13, and I used to sleep downstairs and give the 2 a.m. bottle. And I was babysitting for money by the time I was 11. And I just was always interested in babies. And quite determined to breastfeed mine, even though my mother wasn't a successful breastfeeder. So I'm not really sure where it came from, but it's just been very deep in me, very passionate in me. And, I've been involved now for 50 years with mothers and babies on this thing of helping them to breastfeed. And I do believe that the milks that we have, especially the human milks, make the world a better place.
Wow. Yeah, truly. So Patricia, lactation is the connection between the baby and the mother outside the womb. How do you think it is important, and what's its significance?
Well, with mammals, the way we make babies is that there's kind of like a 2-step process. So there is that time in the womb where the placenta does the job of growing the baby, but then there's the time outside the womb where it is the breast which finishes off the development. And it may surprise you, but all milks are very, very different. There's a thing called species specificity, and that's because the milk that one mammal produces is perfect for the baby, but not so good for another mammal. I mean, you look at whales and seals, they've got an enormous amount of fat in their milk. Well, of course, they're in Arctic regions, and that's important. In the milk of the kangaroo is mostly water and very little protein. It's a very hot country, and kangaroos are tiny and grow really slowly. And humans, likewise, we're born very underdone. We're little, we grow slowly, so the protein in our milk is very small. It's only 1/3 that of cow's milk. But the thing in our milk is it's high in lactose, because lactose is important for brain development. So all the primate milks are high in lactose, and dolphin's milk is high in lactose, and the milk of the donkey is high in lactose. It's quite an intelligent animal. When cow's milk has got 3 times the protein of human milk and half the lactose. Cows grow quickly, they're dumb animals. the milk is very white because that's mostly casein. 80% of their milk is casein. It's only 40% in human milk, 60% is whey. That's why we have thin blue milk. I mean, that rubric in our repertory does my head in. I mean, human milk is supposed to look thin and grey. That's good milk. So yeah, they're very, very different, all the milks, and they're just perfect for the baby that they're designed for. So it's a very, very crucial part of development. And it may surprise you to know that lactation in primates goes for 6 times the gestation rate. So humans are supposed to be fed for over 4 years. If you go among, I don't know, the Akung, or you go into the Amazon forest, I mean, those women are feeding their babies that long, because if they don't, they die. There is no formula, you know, there is no electricity, there is no clean water. The mothers have to feed the babies. And in that time, they won't come into estrus because their diet is quite minimal, they're nomads. And so they don't reproduce again for 5 or 6 years. It's how Mother Nature is designed to keep the population in control. And things have got very, very out of control, very out of balance, because we're not doing as nature perhaps designed. But milk is always perfect, always best thing for the baby is to have the milk of its mother.
Yeah, I agree to that. But Patricia, in some cases, due to certain illnesses in the mother or the child, there is no lactation or not enough of lactation that we see. Especially in today's modern day and times, we are not breastfeeding children to the amount they should be. So what is the effect of lack of lactation due to such critical conditions? What is the effect on the mother and the baby?
Well, it's a very sad story because it has a profound effect. I mean, human milk is probably one of the most researched substances on the planet now. You know, the last 40 years, the amount of research that's gone into this area is huge. For a start, if a preemie baby is not given the milk of its mother, it's very likely to get necrotizing enterocolitis and maybe die. Breastfeeding is protective against sudden infant death syndrome. We know from research that breastfed babies get less ear infections, less upper respiratory infections, less RSV. Down the track, that's protective against heart disease, it's protective against diabetes, it's protective against a whole range of things. If you wanted to name any disease, you know, right down underneath it would be the story that the foundation wasn't really good in the beginning. From the mother's point of view, to breastfeed protects against breast cancer. It protects her against osteoporosis. Her heart works better if she's breastfed. So, you know, it's a very complex issue, and the effects and the benefits for mother and baby are profound, but also for the planet. I mean, for, you know, a few hundred calories a day, women produce liters of breast milk, which, you know, are most ecologically sustainable activity there is on the planet is to produce milk. And so we all do our little bit for making the world a better place if breastfeeding can proceed.
So ideally, for how long should a mother breastfeed her baby?
Well, the WHO says 6 months at least, because by then the baby is starting to produce their own immunoglobulins. They do recommend 2 years minimum, and longer if possible. But when we look at the gut maturation, the brain maturation, you know, the organ systems that mature, it really is 3 to 4 years before that's finished. And we know from a psychological perspective that a child, a baby, a toddler needs his mother till he's about 4. Then he's ready to go out into the world. So it's up to the mother and the baby. I mean, some babies will wean. I know my firstborn weaned as soon as he walked. The week he walked, he gave up the breast. You know, he just was his thing, I'm independent. But my other children I had to wean. So it is a very individual thing, but the longer the better. And there is no substitute for the milk of the mother that's producing it for her child. I mean, anything else is a lesser than substitute. It will keep the baby alive, but we swap mortality for morbidity. And I think we need to keep that in mind.
Yeah. So the other day I was just going through one of the articles that you had written, and you mentioned the human milk as white gold. So yeah, there indeed is no substitute to human milk for
It's
breastfeeding.
true. It's true. There is no substitute for it. And it's also true that the mother that I produce, the milk that I produce would be a little bit different from yours or some other mother because of the microRNA that's in our breast milk. And we know that now. This is emerging research, but we know that the epigenetic tags going back 3-4 generations are passed down in the milk. And so if you think of a baby like a hard drive that's got to have its software uploaded, it's the milk that does that. And so there's something very special about one mother's milk for her child. Another mother's milk is fine in a general sense, but from a miasmatic sense, the way we think of things, there's something very special about what's passed down through, the mother's milk to her baby. It's a transgenerational message, if you like.
Okay, so that brings me to one of the Facebook questions that we have just received. So one of the user wants to know that is there any individual specificity or species specificity?
It's both. It's both. I mean, in a global sense, it's species specificity, but then you can come down to that really individual level, and there are nuances from this mother's milk and that mother's milk. Depends really too on what diseases and infections she's encountered in her lifetime, and she will have antibodies to those for her baby. Sadly, we're now into a second generation of women reproducing and breastfeeding who haven't had childhood diseases. So they don't have antibodies to mumps and measles and chickenpox like I did, because I was born halfway through the last century and we got all those diseases as children. And so our placenta and our milk protected our babies. That's the way Mother Nature designed it. So there are some subtleties that differ from mother to mother, but certainly the complex of her life experience and what she's encountered and what she's got antibodies for will be specific for her baby.
Okay. Good. It's important to have that phase in life for both the baby and the mother and for planet Earth that you just mentioned now. Okay. Yeah. There's another question that we are having on Facebook. So the user says, what about females who are not mothers?
Who are not mothers, who have not given birth?
Yeah, I'm not too sure about the question, but I just received it on Facebook.
If nipples are stimulated, the breast is stimulated, they will produce milk. There are recorded cases of males producing milk. Even Margaret Mead, an anthropologist, famous anthropologist, recorded a case of that. And certainly men can get breast cancer. We would have treated those sorts of things in our clinic. So it's just that there's more complex development in a woman so that she's able to produce bountiful milk. But I tell you what, there's a phenomenon coming out now with maybe not so much in your country, but here, girls go on the oral contraceptive pill really young, a lot of them, to manage their periods or for contraception. And when that's happening, they're not getting the normal fluxes of progesterone, which develop the breasts. So we're seeing now some women actually have primary breast tissue insufficiency because their breasts haven't developed enough, in those years, and only in the pregnancy they're developing. So they do struggle to have a fulsome lactation. It gets better with every pregnancy, but there's a lot of complex issues now in society, for sure.
Yeah. And you as a homeopath, do you use a lot of lac remedies whenever there is any lactational issues?
I certainly use Humanum and Lactational for mastitis. and that's well clinical. And I will be presenting some cases on those in the modules that we're doing. And Humanum for breast abscess. Farouk Master said that he had used that, and I have used it as well. And I will be presenting that case during the module. But for breastfeeding issues, I use the whole complex that we have in our repertory. It's certainly, and you'll see that I'm going to be presenting a lot of different cases, and I'll be using a lot of different remedies at different stages, because as I said, sometimes issues in lactation can certainly herald an underlying pathology, and the vital force in its wisdom during a lactation can sometimes take the opportunity to do some deeper healing, because the breast is an exterior organ. Yeah. And so things will shift and move to the breast in order to be resolved. So if someone comes in with cracked nipples and you give castor equi, the nipple will heal, but you could get an abscess. I've had it happen to me. So you've got to be careful and be prepared to follow the vital force, the expression of the vital force. I've had cases of women come in where I'll take the case and it's Asterius rubens, and I'll go, oh, I don't like this, and you give the remedy and it shifts immediately to sepia, and then you can unfold it, and then that breast will lactate, and you know that it's healed, and the chance of a breast cancer down the track is minimal. But it takes time and it takes care. You've got to know what you're doing, and you've got to understand how the breast relates to the rest of the body in terms of physiology. Yeah.
Yeah, and certainly we do see a lot of lactational issues these days with the modern world, the changing society. A lot of issues that come up. So as a homeopath, how important it is for us to be trained in knowing such issues, managing clinical issues, counseling new mothers.
Well, if you can't manage the clinical issues, the lactation will fail. And so, of course, that's huge, really, for that baby, because it means from a gestational point of view that the gestation is incomplete. And I will be covering in the modules in week 2, I'm going to be looking at, nipple trauma, low supply, too much supply. What are some of the other things? Colic, lactose intolerance, just those ordinary things that you see in those early months. I'll be covering those with examples of how to manage them clinically and some cases. In week 3, I'll be looking more at the inflammatory conditions like thrush and white spot and mastitis and papilloma of the breast. I'm going to present a case of papilloma of the breast, very complex case that took 6 months to resolve, where the breasts were producing frank blood. But, it got sorted in the end. That woman went on to become a homeopath. So, it is a very complex issue, but I'm happy to tackle most things. And I think if you take time and you're careful and you understand the intricacies of anatomy and physiology, not just of the breasts, but of the whole body, and if the patient is prepared to go with it, because quite often when you're treating these things, women will really suffer, especially if they've got cracked nipples, bleeding nipples, in a lot of pain, if they've got thrush in the ducts, that sort of thing. And things are not easily and quickly fixed. But the thing about breast milk is it's very healing. And if you can keep them focused on that and let them know that all the time we can keep the lactation going, the breasts are getting more and more healthy, and that's good to focus on the end goal. And of course the baby gets the benefit of the milk for longer. The longer the better.
Yeah. So from what you have said, I think those who are listening also will know that homeopathy plays a very important role in lactation and the issues that come along with it.
Oh, absolutely. And it's amazing. We've got so many remedies that we can use, and we're probably the only people who can really, really sort lactation issues out. If somebody understands the clinical side of lactation and is a homeopath, there should never be a time when you don't get it sorted. Really, honestly, I do believe that. There's nothing that couldn't get sorted. If the mother is willing and the physician is able, I can't see any situation where you wouldn't be able to sort it out.
So we are fortunate to be of help to new mothers also in that situations, right?
Yeah, well, it's hard, a new mother. She's in a learning situation, and with every baby, it's a learning situation. I mean, I had 3 children, and my third one was born a couple of weeks early, and I had a big lot of trouble with him, getting him established, and then I had all sorts of problems, and he was lactose intolerant, and it was a nightmare, but it taught me a lot. It taught me a lot. But because I was an experienced breastfeeder, I was able to sort through it. But, every baby's different.
Absolutely. That's the key to homeopathy also, that we see everybody as different individuals and different remedies are given to them.
That's
That's the
right. Teaching the
beauty of,
individual. Yeah.
yeah. Okay. So lactose intolerance has been actually a very big issue, ongoing issue actually, because many children are becoming lactose intolerant. I think in the olden days we hardly have heard of such words used actually, but nowadays in clinical practice we see a lot of children coming up with this. And we also have one question on Facebook asking for your experience and what remedy you use in lactose intolerance. If you could just tell us.
It's not so much a remedy, but it's a method of treating. Now, the enzyme lactase is you need to have plenty of that for the baby to cope with lactose. So at birth, a baby's lactase levels, are about 75% developed. So in that first few weeks, it needs to catch up, and they need to get more and more in the gut. Now at birth, a woman's zinc levels are really low and her copper levels are really high. That happens naturally so that she can have good, strong contractions to have the baby. And that's why at the end of pregnancy, you've got stretch marks and your hair's falling out and you just feel, blah. That's because you're low in zinc. So it's really important just after the baby's born to get the zinc up. So sometimes a supplement to do it, but then diet, I really emphasize diet. I'm going to talk a lot about diet, the importance of diet, zinc-rich foods to get the zinc levels up so that the lactase enzyme can flourish in the baby's stomach. And so there are some dietary protocols around all of that. So getting your protein up, your fats up, and the simple carbs completely out of the diet. So anything with an OS, and there are 22 sugars, get them completely out of the diet till this is all settled. So if a woman has lots of protein, lots of fat, and no simple carbs, the lactose level in her milk drops and the baby can cope a lot better. Meanwhile, she's got to get a lot of zinc on board so that the baby can get the benefit of the zinc and grow a lot of the enzymes. So it's quite a complex thing, but it's certainly treatable, easily treatable. And there's actually an article about this on my website. If you go into published articles, I had it published in a medical journal like about 30 years ago. And it was a small pilot study that I did. And look, honestly, within about 2-3 weeks, all the babies were sorted. And all I did was change the diet of the mother. Didn't give any remedies. This was before I was a homeopath. So it's fixable. Absolutely, it's fixable.
Good to know about that, Patricia, from you. And I must say that you are so armed with the knowledge about lactation, right from the physiology and even the clinical issues. I can't wait to hear from you in the module that we have.
I'm quite excited about preparing it and getting it ready for you. It'll be a couple of hours each session, so it'll be jam-packed. Lots of cases, lots of clinical tips. We look at materia medica, and of course, look at the anatomy and physiology of lactation as well. So it's going to be a teaching experience and a learning experience, which is, I think, the best thing, because it's not the sort of thing we cover a lot of in college.
Yeah. But it's always nice to know something extra.
Yeah, absolutely.
Yeah.
And we grow all the time, and we're learning all the time. I still get excited if I have a case and I say, I didn't know that rubric was in that remedy. and it's just great. And of course, the issues now in lactation are getting more and more complex because of the COVID vaccine. and I'll touch a little bit on that, but, you know, we're seeing babies now early on who are really struggling because their mothers are producing spike protein that they've got to cope with. So that's another thing that's an ongoing thing that we're, I don't know, watch this space. So it's difficult.
Yeah. So Patricia, we have another question. What about women with implants? I have a few friends who struggled breastfeeding and have been told it is due to implants. Do
Yeah,
you
could
think
well
there's a
be.
way?
Yeah, it
Yeah.
could well be. It depends where they are. If it's sitting against the chest wall underneath all the ducts, quite often that's okay. But even so, women do tend to have a lesser supply. If there's been any damage to the nipple and the nerve impulses around the nipple, certainly it will cause problems. And I must say that in every case that I've helped a woman where there've been a reduction, some surgery to the breast or implants, the lactation hasn't been as fulsome as it could be. Yeah. But then you can use a supplementer. So that's it's a device you can wear around your neck. So it's a bit like beads hanging around. It's a string little pouch, and you can put a bottle of express breast milk in there. And there's a tiny little piece of plastic that you can tape next to the nipple, so the baby will actually get the contents that's in the bottle while they're milking the breast. And then the nipple gets more stimulation, can make more milk cells. So it's a win-win, and you can still breastfeed using that. So there's ways around it if the woman wants to breastfeed, but certainly implants don't help. And if a woman has got small breasts, she's still got all the duct systems. They just happen to be up under her armpit and around the back. I mean, I've known women when their milk comes in not being able to put their arms down for a few days because there's so many full milk cells, you know, up in the axilla. So, you know, a lot of what's in a big breast is actually fat. It's actually fat. So, and that's why they droop and sag once you've, you know, hit your menopause.
It's all phases of life.
Yeah.
So Patricia, I just want to tell our participants or those who are watching that we have a full-fledged module that we are going to do with none other than the lactational expert, Patricia Hatherly, which is coming up soon in the month of September. And she's going to talk all about milk, about the lactational issues. So I think if you have any further questions in this live, I think the module is the best place for you to be in and get your questions answered. And she'll be also talking about the role of homeopathy and the remedies, the therapeutics, and how as a homeopath we can help our patients. So this is what we have in the upcoming days, and the early bird for that ends in August. So those who wish to register, I think you can avail the benefit of the early bird as soon as possible. And
the other thing too that I'm going to cover in the module, it'll be the last week, I'll be doing in-depth look at the materia medica of Lac Humanum and Lac Maternum to show how they are different from each other, and showing some cases of both so that people can have an understand. So that won't really be so much on lactation, but looking at the human milk remedies that we have so that people can understand them a little bit better. People get very confused and they say, you know, what's the difference between Lac Humanum and Lac Maternum? Well, Lac Maternum's got colostrum in it. That's why it's different, and that's why it's about incarnation. You know, it's about getting the vital force settled in the body, whereas Lac Humanum is all about growing to be the best person you can be, which is what human milk does for a baby.
Amazing. I think this was a much needed differentiation actually with respect to Lac Humanum and Maternum. Very confusing, but as you rightly said, and I think in the module you will be even detail, you will be explaining to us in detail. So I can't wait to hear that from you, Patricia. Any final thoughts, any comments, Patricia, for all your users and fans out there?
Well, as you can see, I'm very passionate about my subject. So, you know, I would encourage you to sign on and join us, because it will be a very enriching, I hope, learning experience and give you more confidence in the clinic, which is, what we want, because to save a lactation is not just, as I said, good for the planet, but, certainly good for mothers, but of course of primary importance for a baby, because, we're still growing them outside the womb. And if the lactation fails, well, from a miasmatic point of view, SORA is set in the underfunction, where there's that lack, is in capital letters really then going forward. It is a big thing. It is a big thing. It's not a trivial thing. And people think, oh, it's okay, we've got formula and da-da-da. Formula will keep a baby alive, but it will not give it the maximum benefit that its mother's milk would give it. So if we can help get that sorted, get them both started, there's lots of benefits to be had, and the world would be a better place.
Yeah. So Patricia, you're so motherly. I think that's the answer to my first question, from where you got fascinated with human milk, because that's in your nature. You're so motherly and so passionate. Thank you so much, Patricia, for your time. I think it's
My pleasure.
past 9:30, and that you agreed to do this with us. Thank you so much. I think today's session was a good trailer for anybody who's interested to sign up for the module.
Well, I look
Thank
forward
you,
to seeing
everyone.
you all when you sign on.
Yeah, I'm sure now we will have some interested folks who would like to know more about lactation. Thank you all for joining in for today's live session. Stay tuned to this area. You will get posted as and when we will have any updates on any of our upcoming modules. And just a reminder that Milk Matters will be in the month of September. Thank you so much, Patricia Hatherly, for joining us today.
My pleasure. Bye-bye, everybody.
Bye, everyone.